lost a lot of blood. We're gonna get you to the OR. You're gonna be just fine. Yeah, let's go, let's go!
What's up, party people? Hey, it's Dr. Buck Parker. I am back with another reaction video. As a general and trauma surgeon for over 10 years, I'm gonna watch and react to a little clip of Saving Hope where a patient gets stabbed in the chest. So let's check it out.
Excuse me? You can't be in here. Let's get you back to your room.
What? Yeah, so right away, I think, well, what you notice here is the patient got stabbed, well, doctor in this case, got stabbed by a patient in the left chest, kind of high on the left chest. What I would say immediately is this is what we call the box of death, which is the middle of the clavicle, down to about the nipples on a man and across. Why does the patient just lay down? What's really interesting is a lot of times the patients get shot or they get stabbed or something like that, and they don't really know it. So they hear some gunshot, they think they got hit, and they end up with a stab wound. Now, I have never seen a patient get stabbed in the box, so I don't know the exact sequence, but what could happen is this could go into just the lung, or it could go into a great vessel, or it could go into the heart or the subclavian. With one of those things, it wouldn't be sort of like immediate incapacitation. And so a lot of times on TV, you see somebody get hit with something or like a gunshot wound or a stab wound, and they immediately die, which is not usually the case unless it's like a gunshot wound through the brain or the spinal cord or something like that. Then they would immediately be incapacitated. So something like this, where she's a doctor and she gets stabbed in the box, and I think she's a trauma surgeon or a general surgeon or something like that, which she would know about, or even an emergency doctor. So immediately then she should go and hit the code blue instead of laying on the floor, I think. That's just my sense. Also, I've never got stabbed in the chest, so I don't know what I would do either. This is actually correct, is you would leave it in until you got to the OR or very, very close to making an incision, or even sometimes we would prep the object and just leave it in, put like the iodine and prep around it. It's not sterile, but it's, you know, as clean as you can get it. And you make your incision and you find out where it is, and then you take it out after you have sort of everything isolated and controlled, and you think, oh, well, this isn't in the subclavian. I'm going to clamp both sides of the subclavian and then take it out so that way it doesn't hose bleeding in my face, right? Something like that.
I got it. Maggie, you're with me. We're gonna do a left thoracotomy and find the bleed. It's in her heart.
I'm here, baby. I'm here.
I'm not gonna know until we get in there.
Left anterior thoracotomy is very common in trauma, especially for injuries to the left chest, even injuries to the right chest. A lot of times you would start with the left. You can extend it over across to the right side, open it up like this, like a little clamshell.
Look at me. Look at me. I love you. I love you. We're gonna fix you. I'm right here, okay? Keep your eyes open. Look at me. Look at me. Hurry!
Yeah, so it's really hard to keep somebody awake when their blood pressure is like 0 and their heart rate's 180. So
give up, baby. Done!
What are you doing?
I can't do compressions with the scissors in.
And I've been in these situations where, you know, patients dying and stuff, you always got to put on your gloves and your gown and your mask because blood goes everywhere. You don't know who's got what. It's really important. Personal protective equipment. Don't forget that, because if you have a problem, you can't help anybody else.
Okay, get me iodine and a scalpel. I'm opening her up.
And that's correct too. Iodine and scalpel, that's pretty much all you need for a left anterior thoracotomy. It works pretty good. You can get in there. You can get in there probably less than 60 seconds.
I need a chest spreader, bone saw.
You don't actually need a bone saw for the left-sided anterior thoracotomy. If you're planning on extending over the sternum to the left side, you can do it with scissors or you can do it with a saw. So you do use a rib spreader, which is called a finichetto. You can get in between the ribs. You don't have to break any ribs to do this. You can just go between the 5th and 6th intercostal space and spread those ribs and see everything pretty well. So something like this, you would make an incision in the skin, basically over the top of the 6th rib or 5th rib, and then spread the ribs, and then you can see the heart, and then you can make an incision in the pericardium just medial to the vagus nerve. A lot of times you'll see the vagus nerve. Open the pericardium, see if you can find the hole. It's usually in the anterior heart. Sometimes you can just do regular sutures. Sometimes you need little pledgets. Obviously there's a couple other things that we talked about before. It could be those. If it's that, the tension pneumothorax is a lot easier to deal with. The subclavian artery being injured and the aorta injured is a very difficult situation as well. So good luck on those. All right, awesome, you guys. Hey, thank you so much for watching again. Hope you guys enjoy these. If you do, please subscribe and leave a comment below, and I will see you in the next one.